What if they have MTHFR deficiency and COMT, activity abnormality? MTHFR deficiency with low COMT. Think about that cycle I showed you. What happens? You lack the ability to make serotonin, dopamine, epinephrine, but the little dopamine you have around sticks around. So this is the time where I would give a lower dose of L-methylfolate. But I do warn the patient, if you get anxious, even with that low dose, you better stop it, because that's what's happening. And that's happening with my patients, even at low dose. So sometimes when they have this problem, I give them a super, super low dose of L-methylfolate, sometimes only like 800 micrograms, because they need something, but they don't need a lot. Then sometimes I will add the serotonin-based supplements, tryptophan, 5-HTP, because it makes serotonin. And if you understand that cycle, there is no increase in the dopamine. Talked about SSRIs will also keep the serotonin around, counteract some of that dopamine. I love this gene because this is what I call MTHFR deficiency with high COMT, the double whammy gene. And I saw that in a patient yesterday. He came back as a follow-up to discuss his genetic testing. And I saw this low serotonin, low dopamine, low norepinephrine, and the little dopamine you have around, it's gone. So I asked that patient, said, how long has it been that you've been suffering from depression? And he goes like, well, doc, probably since I was a kid. This combination can explain a lot of things. So what do? As we know, there is hypermetabolism of the dopamine. I often start with L-methylfolate, but if they're really really bad, then I will add that tyrosine, because there's that deficient in dopamine and a hypermetabolizing dopamine. So knowing, going back to that cycle, why I would give L-methylfolate and tyrosine. And of course, this doesn't work right away. Melanie, we have that patient, mutual patient who had that problem. Mm-hmm. It took how long? I would say in the 6th month, he was amazing. Yeah. And he's afraid, is this going to go away? I said, no, because we were treating the underlying cause.